Good morning, and thank you for joining today's CAS conversation. Before we start, I would like for all of us to take a moment to reflect on where we are in history. We are changing our ways of life to adapt to a global pandemic. We are seeing a historic moment in civil rights with the call to action to address racial inequities in all arenas, including healthcare, law enforcement, and housing. We have seen Supreme Court decisions that were announced earlier this week to expand the rights of people who identify as LGBTQ and for the Dreamers. So honestly, sometimes it's hard to keep up with the world's news, but I'm so proud and so happy that in our little corner of the world, working together to make small changes for the good in our community every day. If everybody could just, I'm just gonna mute everybody for a second. Okay. So today I think we have a good program planned for you. We will be having 4 short presentations on different aspects of getting back into the swing of things. I am very sure that we have not hit on everything, so I'd like to invite you all to chime in to let us know about what you're doing in your own agencies throughout the meeting today. If you are not speaking, please keep yourself on mute so we can cut down on background noise. You are also welcome to write in the chat box as well. There is a web address on your screen. I hope everybody can see it. It's a little light, like it's a little bit light, but I can also put the link in the chat box for you to just click on. So I'm going to send that now. So if you could please open up a browser, go to that site. I will be using that as a way to get feedback throughout the presentation. And I also want to let you know that this session is being recorded and will be posted on the CAS YouTube channel with our other webinars. That's not normally what I do for the CAS conversations, but I'm going to do it this time because I got a number of responses from people who wanted to be on the call but could not for a variety of reasons. So I am going to go ahead and record it today. So I'm going to unmute everybody. So please make sure that you are muted.
What's your coffee? You're not ready yet.
And we are going to go and start the presentation. Okay. Okay, I muted you all again. Somebody is not on mute and is speaking. So I'm going to mute you all again just for a couple of minutes. Okay, so today's presenters, I'm going to go first, going to talk a little bit about public health concerns. Taisia and Arielle from the Mental Health Association are going to go next, talking about how to do outreach in a safe way. Becca from the Family Promise of Morris County is going to talk to us about care planning. And Kelly from EDGE is going to talk about best practices around technology. So before we start, if we could go to that website that I let you know, sent the link for, and just say, what is your agency's reopening status? I'm putting it in the chat box again as well. Have you just not heard anything? You're already open. Some are open to the staff, but not to the public. We don't know yet, right?
Hello, this is Maria Lopez from Zufo. Just to make you aware that Zufo never closed, so we're continuing to be open for the public. The only section of Zufo that's been closed is the dental department. We're waiting for certain approvals from the state, but that's it, pretty much it. Zufo is open, and by the way, we are offering free COVID testing to anybody that calls in for the test. They don't have to be patients of ours. They just need to call in and wanted to make an appointment, and they will be scheduled in at any of our sites. That's pretty much it.
Thanks, Maria. So I'm seeing most of you are already fully open. So maybe you're just here to sort of get an idea of if there's any changes you want to make to your program or anything. And for those of you who are not yet open, you know, hopefully this gives you some good ideas. Okay, that's me. And so just a little bit more about me is that I am not an expert on COVID. And just because I'm affiliated with healthcare in the hospital doesn't mean that I know everything about this topic by any stretch of the imagination. So, you know, please provide feedback if you think I'm missing the mark on anything. But this is hopefully a good overview of the key points that we need to be looking at from a public health perspective when we are looking at reopening. One of the things that we know, you know, this is something that I do know with my work with HIV and infectious disease, is that the best way to combat anything is through prevention. It's better to not get it in the first place than to have to deal with it afterwards. So this is a little video. It's from WHO, the World Health Organization, that I thought was like kind of like a fun little graphic. It's about 2 minutes long to kind of watch. Let me know if you have any trouble hearing the video.
Preventing COVID-19 in our workplace or while teleworking. There is everything you can do to protect yourself from COVID-19 in your worksite or teleworking or home. There are distancing measures issued for location and stay informed through information from trusted sources, such as needs authority. Stay at home and adhere to direct contact with anyone using phone.
Okay, let me try this. So I realize that not everybody could hear it. I appreciate that. You know, Joni, that's a good point. One of the reasons that I did choose the video is that you can read the words, but I will send out a link to that video. Honestly, probably it's a lot of things you've already heard. I think that it's a good overview and a good reminder about what it is that we need to be doing as a community to keep everybody safe overall. But also in the workplace, sometimes it's easy to let your guard down. I know that, like Maria, we have not, we have been still having our staff come into the space. We have been close to the public because we're in the town hall building in Morristown, and the municipalities have been closed to the public. So we have not had any patients coming in the doors. However, I am going off site to do testing in other sites that are open, and we are continuing to do telehealth and see patients in other sites. So, oh, hi, whoever caller 8 is, if you could please mute yourself, that'd be great. Thank you. So definitely what I can tell you is that sometimes it's easy to forget when you are all together with your coworkers that things are different now and that you do have to be careful. So it's really an important reminder to just not become complacent and to speak out and make sure everybody remembers, okay, right, we're supposed to be distancing, right? So one of the things we need to look at is space. And it sounds really simple and really easy. Clean and disinfect all areas, especially common areas. Some of the things that I think people forget about is your phones and any headsets that you're using should be also cleaned. Also making sure that you clean from a top to bottom way and from an outside in kind of a way, and always addressing the dirtiest surfaces or most used surfaces first. And so that's one of the things that I think people, forget about is they just go in and start to clean, and there's actually a way that you should be cleaning, especially common spaces. And so being really, really clear and intentional when we're doing our cleaning. And also having like a checklist on who's going to clean and when is it going to happen. And again, not becoming complacent with that feature. So we know that physical distance is the best way to reduce new infections and new cases. So and the video said 1 meter, and I'm pretty sure that 1 meter is about 3 feet. So, we hear a lot of 6 feet talk, but I guess when you're with other people who are not symptomatic and you're using masking and other things, you can definitely reduce that space to about 3 feet. And again, it's a lot about comfort level too. So checking in with your coworkers, like, is this okay, right? So we talk a lot about consent. And so that actually is going to be extending, as people start to come back to work and they're with more people. We have had an increase in anxiety around just interacting with people. And so just checking in, like, is this comfortable for you? Am I too close? And giving people the opportunity to say, well, actually, you're invading my space right now, and I'm feeling like you are too close. And so, doing that check-in. Some of the things that you can do to build this into your programs is to stagger shifts, stagger break times, make sure that people aren't congregating in common spaces all at the same time. If everybody takes lunch at noon, right, and everybody's going to be in the lunchroom, eating up their food, whatever else, all at the same time. And so making sure that we are staggering those kinds of things. Using physical barriers in areas that are high access points, right? So if you have a reception desk where that receptionist is sitting there all day long, having people come in and talk to them, maybe putting a barrier there would be a safer plan. Changing the layout of workspaces. So a lot of times we have people who are in sharing offices, or maybe we need to put up cubicles, again, physical barriers, or maybe we need to, again, consider staggering shifts so that people who are sharing offices aren't sharing at the same time. Closing communal spaces or limiting access to communal spaces. And again, not having large meetings, the video talks as much as possible, have telemeetings. So one of the things that our staff decided to do was we asked JVWS to do a couple of trainings for us to refresh our DV skills at the Family Health Center. And so they did a webinar, and guess what? We were all on our own computers doing our own webinars. Like it was one webinar, we were all on it, but we were all in a different room. And so, that is one option that you can do. We were together, but we were separate. Consider promoting telework. We've seen that telework is a thing that we can do. Oh, did anybody else lose sound? Okay, so Joni, okay, it looks like she might have fixed herself. Okay, thanks, Joni. Again, if that happens again, please don't hesitate to put in chat. Don't sit in silence for a minute and be like, is this normal? Excuse me. So again, we've seen that telework is something that we can do. Not every day. We are all in pretty much client-facing jobs. And so it's really important to make sure that we are continuing that work. But if we can do those staggered shifts, or if we can have rotating shifts, that is something that should be pursued. And limiting visitors and guests. So, one of the things that our agency is doing is you can't have somebody come with you to your appointment unless you need them for some, we have some people who need accommodations and things like that, and they bring people with them. And so in those cases, obviously that's necessary. But for things that for other visitors, other guests to come with the client, is it always necessary to do so? Limiting that. And when those people are coming, doing screenings, and we'll talk about that in a minute. So how do we manage changes to people? So everybody on staff should be taking their temperature before going into work. That's just a best practice. If you don't have a thermometer, your agency should be obtaining one. They are hard to find. And so, please let me know if you are having trouble finding thermometers. But if, all agencies should have a thermometer, that is best practice. Wear a face mask when you're in public. And it would be best to wear a face mask when you are with other staff as well. Practice social distancing in the workplace. We just spent a bunch of time talking about space. Don't stay at work if you become sick. So one of the things that we do know about this virus is that viral load matters, and that the amount of time you spend with a sick person matters. So even if the person has been there all morning and they start to feel sick at 1 o'clock, they should go sick immediately. Don't share headsets. Don't share utensils. Don't share anything that you use around your face. Don't share your face mask. And don't congregate in crowded spaces. For our clients, best practice is to pre-screen your clients for COVID symptoms during appointment scheduling and during confirmation. So for instance, if you schedule a meeting with your client for Friday and it's Monday, you should be calling them again on Thursday and double checking their symptoms. Clients should be wearing a face mask at all times. And some of what we need to be doing with our clients is educating them on the proper way to wear a face mask. And if they don't have access to their own face masks, providers should be providing face masks for those interactions. Again, practice social distancing or physical distancing, as the case might be. And again, educating on the risk of COVID. So talking about high-risk populations, talking about how to hand wash, how to promote healthy behaviors. And be aware which clients are at risk for severe manifestations of COVID-19. And when I say that, what I mean is people who are more likely to end up in the hospital because of a severe response, or people who are likely to need a ventilator or other assistive devices if they do have the virus. And that list is here. Older adults, people with chronic lung disease, like COPD, for instance, people with heart conditions, and we are seeing that people with hypertension are at higher risk for severe manifestations, people who are immunocompromised. And that doesn't necessarily mean everybody, right? So I work with the HIV population, and not everybody with HIV is at high risk just because they have HIV, because if they're on their medication and their immune system is doing okay, then they're just sort of like everybody else. But if you have somebody who, for people with HIV who is viremic, whose virus is not controlled, those folks are at higher risk. And then we have also, cancer survivors, people who had been on chemo treatment, and, people with RA and other autoimmune disorders as well. People who are severely obese, people with diabetes, people with chronic kidney disease, and people with liver disease. So if we're talking about how we're going to do a screening, this is the symptomology around COVID-19. Originally, it was thought to be an a lower respiratory tract infection, or mimic the symptoms of a lower respiratory tract infection, we know that the fever for COVID is actually lower than most fevers. It's over 100. And so that's one of the reasons that we do take temperatures, because if your baseline every day is 98 and then you take it the same time and you're like 99.9, that's kind of a red flag for you that maybe there's something going on with you. And later, as the disease, as we have seen over the course of the last few months, we have seen that gastrointestinal issues are very common early signs of COVID, as is loss of the taste or smell senses. And also headaches, strange headaches that you can't explain. Those are all things that are new. So you might want to add those if you don't already have them in your screening. You might want to add those symptoms. So a few tools and checklists. Again, this is all from the CDC. This is a flow sheet for should you open, and if you are opening, what actions do you need to take to reopen. So again, I'm going to send out these slides, so this should be available to you. Here's another one. So remember, I talked a little bit before about cleaning and disinfecting. It is important to have a plan in place for cleaning. You can't just say, well, we're going to keep things clean, and that's your plan. You really need to be thinking about what needs to be cleaned, how it's going to be cleaned, what do you need to clean. There are different levels of chemicals that can be used, and so you want to make sure you're using the appropriate chemical and nothing that is too harmful, but also something that is sufficient to clean for coronavirus. And so this is, again, I'm going to send out these slides. And then this is specifically for homeless shelters, a good flow chart for how to screen for symptoms. And so there are more tools on the CDC website that you can access. So for employers, this is, hang on a second, I'm going to copy and paste this into the chat box. This is a link. Oh, hang on, that's not what I want to do. Copy link, okay.
Hello?
Yes, can you not hear me? Can everybody hear me? Okay, so.
Yes. I can hear you.
Okay, good.
Yeah, we can hear you. Right here, Dad.
Thanks. Somebody said hello, and I got nervous that nobody heard me.
At the light, turn left onto Centennial Avenue.
Just put yourself back on mute. Okay, from this. So I just put that link in the chat box. It is a over 30-page sort of manual on the best way to prepare for workplaces, your workspaces. Excuse the airplane flying over my head. I am outside. My husband is in the office and my kids are running around like crazy maniacs in the house, and so I am outside. So I apologize for the airplane. So for employers, again, we should have a system in place for assessing symptoms and taking temperatures. There is a gray area here around privacy and health privacy issues with your staff. So you want to make sure that you're doing this in a sensitive way where you're not prying into people's personal health histories, but that you are making sure that your staff is not symptomatic with COVID symptoms when they're coming in. So this is a delicate balance. You do want to really pay a lot of attention to your system. It can't just be a blanket system. You really have to put some thought around this. If an employee becomes sick during the day, they should go home immediately. So you should have a system in place where there's no retaliation for saying, hey, listen, I don't feel good right now. And that there's a system in place for covering clients or covering duties so that people don't feel like they have to stay if they don't feel well. Before you open, you should have everybody come in and wear their face masks and see how they work and make sure that if there are any barriers to using face masks, that those are taken care of before your official opening. You want to work with maintenance staff to increase the airflow in the building. You want to make sure that, again, we are looking at a system for cleaning. You want to make sure that all staff are trained on health and safety protocols and they're trained on proper messaging that you want to give your clients. Your clients trust you to give them accurate, reasonable information. And so making sure that everybody is on the same page about what you're telling clients. Promote healthy hygiene practices. So, putting those signs everywhere that say had a hand wash and putting suggestions for songs they can sing in their head while they're washing their hands. For employers and directors, you should be wearing the cloth masks the appropriate way to set an example for the rest of the staff. And you should also consider accommodations for staff who are at high risk for severe reactions to this virus. So again, a few slides ago, we had a list of the people who are at higher risk for being hospitalized for COVID. And that extends not just to your clients, but we also want to think about the staff as well. And again, we want to make sure that we're not prying into people's health histories, but they do feel comfortable to come to you and say, I'm worried because my doctor says I have hypertension and I'm worried that if I get COVID, it's going to be my death. And that's a really common fear right now. And it's something that we should, as compassionate employers, be considering for our staff. Again, this is the website, cdc.gov. All of this information can be found there. Again, this is not original. Basically, what I did is I gathered what I thought were the most important points and spat them back out to you in a bunch of slides. So if you could take a moment and go to that web page and just, if there was anything that you learned or something that you hadn't thought of, or something that you thought of that I did not think of, it would be great to please put that, write that down. I'm going to give everybody a moment to write down what they took away from this or something that they'd like to add. Thank you. So specific cleaning methods were helpful. Good. Thank you. Be safe, everybody. Absolutely. So I think that, okay, yeah, test out wearing the mask before opening. for sure, something that's definitely new to us is wearing masks everywhere. At our organization, we scheduled everyone an area to clean and maintain to reduce the spread of germs. So good, making it a team effort. And again, making sure everybody's trained in the best ways to clean, right? So like you might have Joe cleans the bathroom on Monday and he does a fabulous job, but then Tina comes in on Tuesday and kind of just wipes things down. We want to make sure that we're being consistent about our cleaning as well. Ask about health daily. Yeah, so making sure that we're doing those screenings regularly and not becoming complacent about it. Great. So I am going to, how do I get, oh, there we go. I'm going to turn it over to Taisia and Arielle, who are going to talk to you a little bit more about how to do safe outreach. And so Mental Health Association has been going out and they have already been doing and continuing to do outreach in the community. This is like outside of your workspace, right? So, okay, go ahead.
Can everyone hear me?
Yeah.
All right, great. So hello, everyone. I'm Taisia Koeppel. I'm the Program Director for Community Support Services at MHA. I'm just going to start off talking about like what we did to change our services once the pandemic started. And then Arielle is going to finish up with how we changed recently to do safe outreaches. So, you know, the first thing we did was obviously we had to start following CDC recommendations. So I would say within the first week or two, we decided that we had to really stop face-to-face outreaches. 99% of what we did pre-pandemic was face-to-face, and we at that point realized that that was not safe for the consumers that we were serving or for the staff. So we decided to switch over quite quickly to telehealth and telecommunication. The good thing about that is that for anyone that bills Medicaid, they were accepting of that being a billable service. So that really helped us in the long run as well. So not only were we able to quickly change our services so that there was no interruption, but we weren't being impacted financially either. So that was really helpful for our agency. We then decided that it was a good idea to start social distancing, right? Because we had staff in the offices basically all day doing telehealth and telecommunications. So it wasn't the same as it was before, where staff would come in the morning, get their vehicles and go outreach their consumers. Now they were in the offices, they were socializing more with each other, they were hanging around themselves. So at that point we said, we need to start rotating staff schedules. So we only have 25% of staff in the office at any time each day. So we, in Essex, we have staff there 7 days a week. So Saturday, Sunday, Monday through Friday. And here in Morris, we have Monday through Friday. So we really had to figure out how could we limit the amount of staff here without interrupting services. So we have only certain people in the office on certain days, and the other ones are at home working remotely. And when they're working remotely, they're doing telehealth and telecommunication. And when they're here in the office, that's when they go out and they do things like, for example, food delivery, right? So we really became a services on behalf of the consumers at that point, and not services with the consumers. So a lot of things had to change. So we couldn't take people food shopping. We had to go food shopping on their behalf. We're so used to doing things with consumers, we had to change the way our brains worked and say, now we have to do things for consumers. So we would go to the local ShopRite, we would pick up the food for them, they would provide us with their list and their debit card or their money, and we would food shop for them, then we would bring it to their house, we would drop it at their door, call them, let them know that it was there, make sure that they received everything, and then go on to the next person. We also become sort of like a food donation center, so to speak. So we connected with a food pantry in East Orange called Joy's Angels, who provides us with weekly donations to both Morris and Essex County. And we provide food bags basically to individuals on a weekly basis. So we're supporting some of the local boarding homes, we're supporting people who live independently, we're supporting people who are homeless. So we're making sure that everyone's basic needs are met. So that was our big change at that point, was going from, you know, building skills with individuals in the community to make sure that they're successful living on their own, or, you know, finding housing, to, okay, now we have to make sure that their basic needs are met, just so that they're safe and that they have everything they need. So that was the biggest change in our services. So we continue to do the telehealth and the telecommunication, but we're also starting to do some safe outreaches. Can we go to the next slide, please? Thank you. So some of the safety precautions, obviously we need to make sure that we're doing things safe, in a safe way. So I spoke about the rotating staff schedules. We provide personal protective equipment to everyone in the office and to our consumers. So we are lucky enough that we have an abundance of face masks, gloves, Lysol wipes, hand sanitizers. We disinfect our agency vehicles on a weekly basis. So we're really taking, you know, keeping things clean and protective seriously. We rearranged, I know Allison spoke about this, we rearranged our entire office space so everyone is at least 6 feet away from each other when they do come in. So in the past, we had desks basically in little clusters, but we had to break them up. So now we have desks pretty far away from each other. So it doesn't matter if we have 2 people who were sitting next to each other come in, they're going to be at least 6 feet away from each other. We now ask that staff self-monitor. I know Allison spoke about this as well before they come in. So each Sunday we send staff an email. Just a friendly reminder before you come in each day for the week, make sure you're monitoring your temperature, any symptoms you may have. If you're feeling ill, you know, we advise you to call your supervisor, and also to advise you to call your primary care physician, who will let you know what the next steps are. And then we also have what's known as like the quarantine list for our consumers. So some of our consumers were affected by the virus, and so we can't go see them face to face, right? So we would still be able to do things for them on behalf of them, but we know that we can't be working with them. We can't have them in our cars. We can't, you know, help them bring up the groceries. We would have to really monitor what their symptoms look like, and we keep a list of those individuals, and we check in on them daily to make sure they're okay. And then at the end of the 14 days, we see if they have any more symptoms, and then we take it from there. Arielle, did I miss anything?
Nope, I think you covered it perfectly.
Okay, you're up next. Can we do the next slide, please?
So the PATH programs at both locations, our Essex and Morristown locations, have still gone out in limited capacities throughout the whole pandemic, but we are now increasing that across all of our programs now that things have kind of calmed down, and we are just taking the precautions necessary. The first thing that we do when we're going to do a safe outreach is we talk to the consumer on the phone and do a self-monitoring with them. Have they experienced a fever? Have they had a cough, worsening of a cough, a shortness of breath, runny nose, sore throat, chills, you know, all the things that we kind of have been talking about. If they say yes to any of those symptoms, we then obviously at that point would just do a telehealth visit rather than going to see that person. Sorry. If the person does not have any of those symptoms, we then are calling them and going to the location that we're meeting them at and asking them to then come outside. So rather than going inside to their apartment or inside the shelters or wherever they might be, we're asking them to come visit with us outside so we can be in a nice open space. We've even gone so far to work with certain locations, like one of our shelters in Newark has actually set up a tent outside with tables and chairs where we can meet with people outside so that we have a consistent space to meet with individuals, that the consumers know that we're coming, and then we're able to safely meet with them. We're providing personal protective equipment for staff and then also providing it to the consumer. So if the consumer comes outside to meet with us, we're then giving them masks and gloves to make sure that they are protected as well as us. And of course, we're social distancing. So we're staying at least 6 feet, and I think we've even said to go as far as 10 feet apart from individuals. Sometimes we use the length of a car as our marker. So we'll have the consumer stand on the one end of the car by like the hood, and then we'll stand by the trunk just to make sure that we're maintaining that distance. So you're kind of using markers and setting up like areas where we can actually see the distance so that we know what that looks like and that the consumer has a visual so that they're not going to kind of break that barrier. And we've also done that in office as well. So sometimes we have consumers who still come into our offices. So on our floors, we actually have stickers that say maintain 6 feet apart, and we'll actually mark out 6 feet throughout our offices so that if a consumer does have to come to the office for whatever reason, they can stand on one marker while we stand on the other, and we can still have that safe outreach. And then transportation, for the most part, we have limited or stopped providing transportation if it wasn't necessary. We've been utilizing Uber Health and having the consumer transported through Uber Health to their appointment, and then if we need to meet them on site to then provide them with some assistance, we will. But if we absolutely have to transport, what we have been doing is making sure we're using a larger vehicle, like a minivan rather than a smaller sedan, and then putting them in the furthest seat away from us, as well as keeping all the windows down and making sure that everyone has masks and gloves on. Taisia, did I miss anything?
The only thing I want to add is one of our directors came up with this brilliant idea when we do safe outreaches to bring foldable chairs so that we're not like the consumer's not on their porch or wherever they may be and we're 10 feet away from them. We can each have a chair, sit down and have a conversation. So I just thought that was also like a brilliant idea to do social distancing, safe outreach. The consumer still gets the service provided. But you covered everything else.
And I see a question in the chat that someone asked, who pays for Uber Health? We have set up an account and the agency has taken on that expense.
Does anybody have any other questions or feedback?
So if everybody could go to the back to the poll, we should have the ability to add your either a key takeaway, something you like, something new, or also if you have been doing outreach and you have been doing something that maybe MHA missed, if you could just let us know what that is. So we see the folding chair idea is very well liked. Don't forget about connecting, chairs to increase engagement, bring the folding chairs, love it. Okay, so important to do the COVID screening with clients we come into contact with, as we may be their only point of contact. That's a really good point. I'm happy to see that my agency is already pivoting to serve clients in a way that is in line with other agencies. So good, so we're feeling some validation that, maybe we were sort of doing things blindly, and it feels good to be engaging. I also want to say that don't forget about the vehicles. I spent a lot of time talking about cleaning bathrooms, but also let's not forget about the vehicles that we're using and other spaces where people are going to be spending time in. Lana is saying, my agency has a reopening task force. I would like to share these slides with that team. Will they be made available? Yes, we will be sending out the slides. And again, I mentioned it at the beginning, but I know that because of the confusion with the cancellation issue, that maybe not everybody was on at the beginning, that this is also being recorded and we are going to be putting it on the YouTube channel as well. Okay, great. Thank you so much to Taisia and to Arielle. This was great. It's like a good case study, I think. Okay. So we're going to move to, and by the way, if you have any other questions or concerns, again, I'm really glad you guys are using the chat box. Definitely keep using the chat box. And again, you can take yourself off of mute and ask ask questions or make comments, similar to how some of you have been doing throughout. So we're going to turn it over to Becca from Family Promise, who's going to talk to us about creating and amending care plans during crisis.
Hi, everyone. Happy Friday. This is Becca at Family Promise. And Allison, can we go to the next slide? Thank you. So this portion will cover refocusing our work with individual clients. We're 3 months in now since we shut down, and we're ready to move away from really the crisis response and the reactive space that we've been in now that we're used to how to do the COVID screenings and direct clients to new resources that are available or resources that are available differently. We'll also talk about prioritizing client groups for services and adjusting how we support the direct client work behind the scenes, including case reviews, team meetings, and our relations with landlords. This guidance comes from the National Alliance to End Homelessness and Org Code Consulting. I included a link, which when you get the PowerPoint slides, you can click on. It's part of the National Alliance to End Homelessness COVID-19 webinar series, and it explained the guidance that we'll cover here. So you may not need to watch the whole webinar, but if you're interested in some more detail and a broader perspective, I definitely recommend it. So next slide, please. Great. So if you are like me and trying to remember what you were doing with clients before the pandemic gives you the spins, refer back to the last service plan. Look at your notes in HIMIS and the last goal sheet. It's helpful just to have something concrete to give you some perspective. What was our focus before health and safety in the context of the pandemic had to take over? And how have needs shifted since then? So likely food security could be an issue. Finances are likely different if someone has lost income or is in a different place with their budget and maintaining their housing in that way. Personal hygiene definitely has a new focus now in the cleanliness of the client's living space. Harm reduction practices, and something that's not listed here would be guest management. If their shelter setting or their housing setting has changed, or I'm just thinking, you know, the warming center clients, if you're banned, what are you going to do now? What are your options given the pandemic? So once we've looked at how our clients' needs have shifted and think about what pre-existing factors may have become more urgent, like substance abuse or domestic violence situations, other issues may seem less important now. Then we want to talk to the client about this and see what's their perspective on what goals they want to prioritize. It's helpful to really, at this point, look ahead at the future and think of the client's long-term goals. We've really been in a reactive space in responding to needs, which are certainly important. Taisia and Arielle covered how to help clients get their basic needs met, and that is certainly the first step. But having the conversation with clients about what are we working toward? So making sure that the client that's in the motel with her baby has diapers, has formula, is in a safe space, but how are you going to get into permanent housing, and making sure that we are working just as hard toward that as we are toward accessing resources to take care of those basic needs. And also working on what the client's goals are, and not just what we want them to be, which is something that is always a factor in our work. Start with what can be done virtually. That's likely something that you can check off the list a lot faster than something that has a lot of barriers due to what's not possible right now. Talk about what needs to be delayed, what's not important anymore. And this is a great time to really leverage client resiliency. I'm sure a lot of you have been really impressed, as I have, with how clients have been managing in this really difficult space. There are issues that we expected people to have. For example, the drop-in center hasn't been fully open. We've only been distributing the mail for people who use us as an address. And we were really worried, how are people going to charge their phones? What are they going to do when they need to use a computer? And the clients have really been figuring that out. And, you know, we've helped them with those things remotely as much as possible. but acknowledging our clients' strengths and letting them do what they can for themselves, that's a great way to progressively engage so we can focus on the areas that clients really do need our support the most. Go ahead to the next slide, Allison. So we don't need to spend a ton of time on this slide, but I think it is helpful to look at how our prioritization of serving clients in COVID-19 has shifted from the norm. So we would like to start with clients who are at the highest risk for death from COVID-19. Those are obviously people who have the most at stake right now. Then we are looking at higher risk for contracting COVID-19. So clients who are have a decreased ability to self-isolate. Maybe they have roommates or they live in a communal setting. Someone who's very food insecure and maybe going into the trash looking for food would be at much higher risk, and we want to make sure that we're serving them first. Other behavioral risk factors may include guest management issues, like if you cannot stay in shelter because you're not allowed to anymore, we have to make sure we get you into a safe place. Next would be clients who are at the greatest risk of losing housing. So maybe they were facing eviction before the moratorium on eviction started, or they've fallen behind on their rent and don't have a great plan for paying it once the moratorium lifts. Again, guest management issues come into play here, and clients with higher acuity, so really complex barriers that make it harder for them to access housing, and really addressing what those specific barriers are. The last group, which right now may be somewhat neglected just based on how much need there is the population that's closest to program exit and self-sufficiency. I would argue that it's okay to move this group up on a case-by-case basis in your prioritization list, just because if there's a very simple solution to someone's homelessness and it's just a matter of helping somebody with a security deposit to get them into an apartment, by all means, end the homelessness situation and just do that intervention. I'm wondering if anybody listening on the call has anything to say about that, and feel free to chime in now or we can discuss in a minute. Either way, I'm ready for the next slide. Great, thank you. So finally, just some important considerations for supporting the direct client work. Number one, let's proactively engage with landlords right now, because if they're calling us, there's already a problem, most likely. So checking in with your client that's in their housing. Is rent getting paid on time, in full? Are there any issues in the unit? Are there any issues in other units that maybe we can help outreach to those tenants? Does the landlord understand current policies, and do they need to get connected to legal services for some more detailed information on what's available to them right now? And we can also help the landlord financially. If there's a client who is unable to pay their rent right now, we could outreach that client and help them get either back rent assistance or help them get connected to other benefits. When it comes to virtual team meetings and case reviews, some helpful practices are just to meet at the same time every week. I know everybody's probably having a tough time juggling all of the meetings and emails. So picking a fixed time and checking in regularly is really helpful right now. It also helps us stay mission aligned and helps everybody feel motivated and connected. Also, there might be a different emphasis on information sharing during your team meeting. So maybe you can cut down on some emails by making this a time to share updates on local resources. And finally, I think this section is probably covered in some of the other sections, so I'll be super brief, but revising our policy and procedure as necessary. So making sure that staff safety and client safety is paramount. You may have shifted to using verbal consents because it's not feasible to get written consent. And continuity planning, if staff are out sick, we want to make sure that everybody has a backup and enough coverage so clients can continue to be served. So that's it for me. If anybody has anything to add, I would love to hear it.
So thank you, Becca. I'm going to put in the chat box the link for the poll everywhere again, so that you can go ahead and put in what was your key takeaway. One of the things that I would want to add, which we haven't really talked about too much yet today, and maybe I neglected it a little bit in my presentation, my part of the presentation, I should say, is essential workers. So, you know, when Becca was talking about prioritizing clients and talking about like who can't quarantine right now, there are people who can't quarantine because their job, their livelihood depend on them being out in the world. And so spending extra time working with them would be a really good point too. So we've got a response on here: proactively engage with landlords before there's a problem. We don't usually do that. Now would be a great time to start. And that's a really good point. And so one of the things that I would like to let everybody know is that we are doing a series. We're still in the middle of planning for it, although we do have our first training pretty much ready to go. In July, starting July 8th, every Wednesday afternoon in July, we are going to be doing a webinar series around eviction prevention and landlord engagement. So please stay tuned for that. We are working with the Neighbors in Need project from Drew University on that piece. So please be on the lookout for that communication. We're going to be doing a general overview education of the eviction process, how things have changed by David Saltzman from Legal Services on that first day, the 8th. We're going to be doing a tenant session the week after that. The week after that, we're going to be doing a session for landlords. And then the last session of the month is going to be pretty much for everybody, presenting the research from the Neighbors in Need project that they have been working on, and doing some work around landlord engagement. So we have a whole team of people working on that for you guys. So please stay tuned for that. Some other responses in here: balancing reactive response with a refocus on goals before COVID-19 and exploring the interplay between the two. I agree. I thought that was a great takeaway. Clients repriority goals, right? So I think that's a good point too. We don't know if the goals that we had before COVID are always the same. And maybe people don't feel, maybe they feel more limited or they feel more empowered, depending on the case. To do things. Rebecca did great. True story. I love the tiers she had on how to engage clients who are at higher risk. Yeah, good points. So thank you so much, Becca. Did anybody else have anything to say, or any questions for Becca? Okay, we're going to move on to talking about best practices around technology. So Kelly works for Edge New Jersey. They have a health care component to their program. So they had to get up and running with good technology right away. And so that's one of the reasons that I chose Kelly to do this part of the presentation. So Kelly, thank you so much. You were going to be our last presenter. You go ahead.
Awesome. Well, thank you so much, Allison, and for all the other presenters. It's definitely been a pleasure to be here today, as well as hearing all the other suggestions. Well, first and foremost, my name is Kelly. I'm with Edge New Jersey. Many of you might know us as New Jersey Aid Services, or NJAS. We have slowly transitioned our name to better encompass our services that we're providing. So we provide services to the HIV community, as well as the LGBTQ community. So January of this year, we launched our medical services with our partner CAN Community Health. And so just like Allison said, it was really important for us to enter a space of telemedicine, and that's something that was new to us. So at this point in June, we are 80 days into working, many of us remotely, and have probably experienced a lot of hiccups with using technology. So I'm going to talk about that in a little bit, but I'm going to go ahead and share what Edge New Jersey has been doing. So right before we worked remotely, it was kind of quick, right? We had a couple days notice before Governor Murphy announced that we had to quarantine and we had to work remotely. So we had a spare agency phone, the numbers there listed, and I oversee that phone. So my responsibility was to ensure all of the outgoing voicemails from the agency main line would be converted to that number, and I would be responsible of passing those messages along to our clients. In addition, all of our clients were given a secure Google Voice number. So Google Voice is a free platform. However, in order for it to be HIPAA compliant, we had to purchase it's called G Suite, and I believe it's about $10 a month for 10 lines, which was enough for our central staff members. And so that would be, the individual would have that Google Voice number, which is automatically populated, and then the client would be able to call that staff member directly and work directly with that client. We did create policy around that, so we had an active date and an inactive date, similar to some of the presenters saying it's important to reamp and look at your policies and procedures to ensure that you're in compliance. In addition, all of our support groups are run virtually via Zoom. Again, there is a free platform, but because we have partnered with Centerlink, which is a national LGBT platform, we were able to purchase a Zoom HIPAA compliant link at a fraction of the price of what it's going for now. And our behavioral health clinicians are providing services via Zoom and or Google Voice number. So all of our services continued just remotely. In addition, similar to other providers who are utilizing Uber Health, we're utilizing Lyft Medical, which is similar. And our driver is providing contactless rides for essential items, groceries, medication, masks, and gloves. Finally, our staff meets 3 times a week for a check-in. So similar to what Rebecca was saying, the importance of ensuring that team members are aware of what's going on with their clients, reensuring if there's any barriers. So we made sure that our check-in was not only a mental health check-in for staff members who are also going through this process along with their clients, but also an opportunity to strategize clients who are living in isolation and didn't have internet access. How do we engage with them? How do we make visits? So the transportation assistant, I'm really grateful for his participation during our contactless rides. He was pivotal in ensuring that individuals remained in compliance with their medication as well as with their basic needs. So Allison, if you can go to the next slide, please. Awesome. So key considerations for adopting and expanding telehealth. Again, this might be redundant, especially since we have now become independent experts with using technology, but I hope what I share can provide a different perspective. So first and foremost, work as a team. I think, Elise, on behalf of EDGE, what I've noticed is a great partnership with other organizations and emphasizing clear communication. It's a lot easier to work in person. You can just walk into someone's office and ask them a question. So communication is pivotal when expanding telehealth. In addition, practice technology first. I know that I logged in a couple times in the beginning of this, a couple minutes before a meeting, and realized that I didn't have the software downloaded, or I was muted and my dog was running in the background, and all these things that you kind of don't anticipate happening as we're adopting new platforms. So what I've noticed is, obviously, especially if we're attending these webinars, that as you're getting those requests to attend and you're utilizing a new platform of technology, to download that technology first and make sure you troubleshoot those problems beforehand. In addition, like many have stated already, the consideration of appropriate screening tools. As of right now, we entered the organization in phases, and at phase 1 has no clients in person. So when we enter phase 2, we'll be doing symptom screeners for arrival protocols. So if anyone is displaying symptoms, we advise them to stay home. So just using your best judgment to ensure that individuals who are coming to the office are in need of the office, but for the most part, everything is being done virtually over the phone. Another thing that was important is creating a backup plan. So with our technology platform, whether it's Zoom or whether it's using our Google Voice, sometimes because so many people are utilizing Wi-Fi, some of the routers have gone down, or sometimes the connection is weak. So for ourselves, we've had to create additional platforms. Sometimes that required us to star 67 and call directly with the client to ensure that, you know, the client knows that we're still here, but we're experiencing some challenges, or helping a client create a email account and having them, you know, practice emailing us first so that we can send out that meeting reminder, or, you know, anything along those lines. Let me see. Okay, Allison, if you go to the next slide, please. HIPAA compliance. HIPAA stands for the Health Insurance Probability and Accountability Act. It protects your privacy as a client and a patient. Under the law, healthcare plans and healthcare providers must limit who can see the health records. That posed to be a lot of challenges for some people, especially when you're working remotely, especially when you're looking at case-sensitive information in the comfort of your home with other individuals who may or may not be pivotal to that information. So space of where you're working is important, especially finding a room, if possible, where you're able to work and use third-party words so that you're not giving out client information around others is important. The same requirements for HIPAA in person applies for telemedicine. So the same diligence you take in person to protect that information. Organizations and agencies now have been really opening their minds about how do we incorporate those practices of compliance virtually. Any questions so far? Okay, Allison, if you go to the next slide, please. Best practices with using video platforms. So again, telehealth and video platforms for many organizations have been trial and error. Best practices would be to ensure that there's no distractions in the background if you're utilizing your video. Try to remove any distracting noise, such as a fan, a printer, buzzing light fixtures. We've all been at this point in a meeting where someone does not mute themselves and you hear everything happening in the background. So that can be really distracting for the facilitator as well as the participants. Clothes, I thought this was interesting when I was researching best practice material. Clothes can be distracting. We've all also seen the videos of someone wearing a suit on the top and some boxers on the bottom. So just be mindful of your setting, and although we're working from home, many of us to keep a professional platform if you are utilizing the video feature. And then finally, remain muted to ensure no background noise, especially if it's being recorded. Next, please. All right, this was my favorite slide. I was really excited to talk about this with you all. A lot of our clients, especially the low-income individuals, are struggling to be part of the conversation. Support groups, telehealth situations, when they don't have access to internet or devices that have that capacity. So I provided some resources from some providers that are offering resources during COVID. The first one is Comcast Internet Essential Service Plan. So that is actually a plan for low-income households. It's $10 a month, and it's, let me just go on to it on the bottom. Low-income households are eligible for public assistance program, and so if they have Medicaid, if they're on SNAP, housing assistance through HUD, those are qualifying measures. So obviously they would have to be in the service area of Comcast. It's also known as Infinity. So if you have an individual who would benefit that, especially with this new COVID funding that I know a lot of organizations are able to qualify for, this might be something that we can get covered for the individual at the cost of $9.95. In addition, Optimum is providing free internet for individuals from kindergarten up to college. And I believe the expiration for this is June 30th. So similar process, you want to call that number and speak to the sales department, let them know that you want to qualify for the free services, and they would waive the service installation charge that comes with that. Finally, Optimum is also doing an emergency hotspot. So this is pretty cool. I live in Union County, and I believe there is a couple of Optimum hotspots in Morris County, but I'm not 100% sure on that. But literally, you would go on your Wi-Fi option and you would see Optimum emergency hotspot. You would just put in your, it would populate you to a web browser, and you would just click OK, and it would provide 1 hour free Wi-Fi. And after the hour, you would just have to go back and click on that option. So for some of my clients who live in Essex and Union County, they've been able to utilize that option in their place of living to ensure that they can do a telehealth visit or participate in our Zoom calls. Spectrum also is doing something similar to Optimum with free Wi-Fi services for individuals who are in school. And finally, something a little bit different is JotForm. It's a free unlimited HIPAA account for healthcare workers, government, and nonprofit organizations. So there is an application form. I would say that in this space, a lot of individuals would qualify for that platform, and that is a HIPAA compliant video chat software. So if you're interested in starting a virtual support group or creating community among your clients and are feeling a little hesitant about how to do so, but also being compliant, I would check out JotForm as an option and fill out that application or send it to your direct supervisor who's able to do that, and hopefully be able to connect virtually with your clients. Next, I think that might be it on my end.
So Kelly, there is a question in the chat box from Lisa. It says, isn't that customers only? I'm not sure which service, Lisa, you were referring to.
For, yeah, I don't know which one either.
In Optimum Xfinity.
I believe that there is additional services and bonuses for new customers. So this might be for new customers. However, what I found helpful is always advocating on behalf of the client. And if a client presents and unable to pay for their service, contacting the provider directly and advocating and saying, hey, this is the situation. It's pivotal for my client to be able to have these resources. What programs and services are you offering due to COVID? And I found that they provide some type of incentives for the individual who are currently being served by that provider.
I also put up, this is the document you sent me, Kelly. Did you want to talk about this at all, or is this just a fact sheet?
Yeah, that is the fact sheet and how you go about signing up for that. So if you can send that out to everyone, that would be helpful.
Okay.
All right, does anyone have any other further questions?
So
one other thing that I might just put out to the rest of the group is, and something that Kelly and I actually had been working on this week at Edge, is as most of us are working remotely still, some of us are doing soft openings and coming back into our buildings, but many of us still continue to work a couple of days during the week from home. Please ensure that you work with your agency site administrator to make sure that all of your antivirus and anti-malware software is up to date. Edge kind of got our hand slapped this week. We had an erroneous malware attached to our server and we had some issues. Thankfully, we were able to clean it and everything was fine. But just be aware that with so many people working virtually right now, these threats still exist. And even though we think our systems are secure, you just want to make sure. So if you have an opportunity to speak with your site administrator, just make sure that all of your software is up to date. If you're working from home, make sure that the software you have on your home computer is up to date and functioning.
Thanks, Rob. That's a really good point to make.
Just a reminder from your friendly neighborhood data quality chair. So good. So I put the link again for Poll Everywhere in there. Very important reminder about security. Thank you. Affordable internet resources for clients are so helpful. One of the things that, as my husband works remotely all the time, he has just a remote job and that's what he does. And so he has a headset that also sometimes cuts down on background noises and things like that. If you're doing a lot of work on the virtually, I mean, he also has like multiple monitors and stuff too. So I'm not sure, you know, like he probably has more than what we need for what we do. But I thought a headset was a good thought. Sometimes I'm on my Bluetooth when I'm on the phone calls. So free internet resources for families with school-age individuals. Yeah, really, really good. The only other thing I wanted to mention is that I feel like a lot of people are experiencing fatigue with the amount of online work we're doing. A lot of us are in our roles and our jobs because we like being with people. So for some reason, it seems very tiring to be on webinars and trainings virtually, and even communicating with people virtually is like a whole new level of exhaustion with all the other things that we're dealing with. So definitely, you know, my little plug for self-care. Take care of yourself. Does anybody have any other thoughts or questions or comments on this part? Thank you, Kelly. So let's check in. How do you feel about reopening? You could be feeling excited. You could be feeling nervous. Maybe you don't want to go back to work. Maybe you've been happy sitting at home and enjoying going outside and doing things. Apprehensive. Good. So bittersweet, overwhelming, easier. So I did this as a word, what do they call it? Like a word cloud. It's a word cloud. Anxious, easier. I like that etc. right in the middle. Maria saying scared of other people not following guidelines of prevention, right? We can't control what other people do. We can only control what we do. I can share that I went to on a hike with my family a couple of weeks ago, and we all had our masks with the exception of my son, who's under 2. And you know, he's not supposed to wear one. And so we were wearing our masks and we were relying on other people to wear our masks to protect my son. And when people had their masks around their chins and things like that, I was having a lot of anxiety. Definitely. Shutting down was easier. Good, Rebecca. I gotcha. So I wonder if I can change this to being in a different format so that everybody's answers kind of goes the way it was before, which I can do when I send out the slides. I like that big forward in the middle. I don't know who wrote forward and in what context, but I feel like that's what we're doing. All of this is just, we keep moving forward in our lives, in our jobs with the resources we have available to us. And I'm really proud of us as a community. I think we've done a lot. So good work, everybody. Thank you. Does anybody have anything else to share? I feel like we did we have, 3 sort of case studies here, not, and actually 4, because I talked a little bit about what I'm doing at my job too. But we've heard from a few of us who have gone through certain stages of reopening or have been working on things in different ways. And so if you have any other feedback or anything you'd like to share about what you've been doing in your agencies, that would be great. This is a perfect time to share that. There's even a slide for it for sharing. A slide for sharing. Okay, it's a mix of emotions. I want to go out and assist our members and provide support, attend community meetings to engage with our community, and obtain resources to better assist our members. But at the same time, we'll be extremely precocious for the safety of all. Is that what you're saying? Cautious. Yes, thank you. I don't know why I can figure that out on my own. Yes, cautious. Good. Extremely cautious. Absolutely. Yeah, I mean, I think that we have to lead by example. All of you are leaders in the community. Our clients look to you, and your peers look to you for what they should be doing. And so all we can do is control what our behaviors are. We can control what happens in our personal space. And so do your best to lead by example. You have a lot of tools here at your disposal. There are tools all over the internet. So good point, Becca, staying connected with our partners so we can keep functioning as a well-integrated system, right? Use each other, use each other. To that end, this is everybody's contact information who was on, all the presenters who were here today. So if you need to reach out to somebody or if you had further questions about what they talked about, this is something you can go ahead and reach out. One of the hardest things for us as a residential setting has been assuring the clients that we are doing everything we can to keep them safe while still providing them with appropriate notifications of risk, all while balancing privacy of other clients. Yeah, I gotcha, Shannon. That has been a challenge for us as well. You don't want to alarm anybody, and you don't want to add to anxiety, but you do want to make sure that we're giving appropriate prevention messaging. It's a balance. It is. I just want to thank everybody for sharing today. I really want to thank our wonderful speakers. Really, really great ideas here. I'm feeling more and more confident after listening to everybody talk that we really have a good handle on what we're doing. So let's keep working together as a community. If you have anything else to share, please reach out. And I can always include it in any of the slides that had the feedback on them. I can include that. And so you can expect probably I'll send a follow-up email later in the day or maybe early Monday morning with the slides and the link to the YouTube CAS, the CAS YouTube channel. Thank you so much for being here. Thank you so much for everybody who participated or who even just came in on the call. And I hope everybody, had something they took away from today's presentation. Again, keep a lookout for our next series of webinars in July. And we are going to be I have some other plans for things later in the summer as well. If you are going on vacation, have a safe trip. If you're having a staycation, I hope that you feel rested this summer and have a great day, everybody.